Thank you for taking the pre-presentation survey. My name is Alyssa.
My name is Kylie.
And I'm Nora.
And we are from the Southern Indiana Career and Technical Center in Evansville, Indiana. And we're here to talk about Mindful Mondays and how to cope with mental health.
Angela Pruitt and Ms. Julie Stuckey attended the NISHE conference last October and attended a session on mental health. Ms. Pruitt had the idea to incorporate Mindful Mondays with Ms. Stuckey and her exercise science team. As we noticed a decline in the mental health of our peers and students worldwide, we wanted to implement a simple and effective strategy to teach students and teenagers like all of you how to cope with mental health struggles and ultimately understand that it is necessary and helpful to give attention towards yourself. In our exercise science program alone, we noticed extreme burnout and lack of motivation. Grades were low and attendance was low. We realized that a strategy must be implemented in order to set us up for success and allow us to finish the school year strong.
Another problem we saw in mental health was how unnormalized it was. 1 in 7 people are affected by struggles in mental health, and this high number is unbalanced with how unnoticed it goes in our society. It's often a taboo topic that gets put on the back burner of issues we strive to fix. By implementing Mindful Monday into our day, we can normalize mental health and prioritizing helping those who are struggling with it.
Building relationships is important for coping with mental health. By combining 2 classes, we helped break the stigma and build connections with our peers outside of our class. This allowed the students to be able to feel more comfortable and to open up and know they are not alone. Since both classes are healthcare driven with the intent to go into the field, the Mindful Mondays provided our peers with ways to care and cope now, later, and to help their coworkers in the future.
As a future professional in speech-language pathology, Mindful Mondays can be an effective and successful tool. To begin, the pressure among myself to be the one that helps primary school children find their voice is so large because those children will depend on me to help them successfully use the most powerful tool a person can have, which is their voice. Working alone and knowing all decisions is up to me can create a sense of loneliness and disrupt the confidence in my abilities. Due to the personal pressure and self-resentment I might feel, Mindful Mondays can be an uplifting activity that will start my week with positive affirmations, reassurance, guidance, and overall send me good vibes that I can implement in my practice and put forward to the children I care so deeply about. Mental health often gets hidden and receives a bad stigma. I would love to normalize the need to take care of yourself, starting in elementary schools. This way, kids would grow up to understand to always put themselves first. Mindful Monday would be an educational and spiritual tool to implement in my future speech-language pathology office.
Let's say I want to become a medical doctor. This pathway is long and complex, and there are multiple ways a future doctor could experience internal struggles, such as taking the MCAT exam, which is an extremely lengthy and difficult test that plays a large role in a pre-med student's resume when applying to medical school. Not to mention medical school in itself, which pushes even the strongest people to their limits. This course is meant to be difficult, but in this demanding curriculum, students could burn themselves out and find struggles in more areas than just their grades. Furthermore, medical school is inexpensive and the debt it creates could put a greater stress on students. Being a doctor is a high expectation role on not just the care team, but also in society. People expect doctors to be put together even though they're just normal people. They have high-risk jobs and are often put in life and death situations. All of this could greatly hurt the internal mind of anyone who takes this career path.
While being an oncology nurse can be rewarding, it can also be stressful. Administering chemo to patients ranging from newborn to senior, it allows me to get to know my patients and their families. Sometimes it will be lighthearted and fun, and other times it will take a toll on my mental health. Between potentially unsuccessful treatment and possibly losing my patients and the connections I had with them, I will constantly be around loss. While this is going on, I will have to keep a positive attitude, masking how I really feel. While this may be my career for the future, the impacts from Mindful Mondays now will help me in situations to come. Knowing what we do and having a stressful job, I can take a step back and regulate my emotions and feel positively to help cope with my mental health. And now you might be wondering why Mindful Mondays are helpful and how they are important.
Mindful Mondays are important for teenage students because their lives are full of milestones, important decisions, and high expectations as they go through high school. Oftentimes, students are so busy and goal-oriented that their responsibilities and activities are used as distractions to cover up internal struggles. This ultimately leaves them with no time and dedication for themselves.
There are so many stressors that can contribute to struggles in a teen's mental health. Grades, assignments, AP, SAT, and ACT exams are just a few of the academic stressors that students could experience. future decisions, sports, school clubs, social anxiety, and even a rough home life for others. These are just the main and most common stressors that could be causing mental health struggles.
Mindful Mondays consisted of combining 2 different healthcare classes and being led in a 10 to 15 minute guided meditation. This provided students with time to personally reflect and prepare for the week to come. It allowed them to relax, de-stress, and fully feel and overcome their feelings. It allowed them to set goals for the week ahead and set them up for a less stressful week. The time together continued to build relationships so that they felt more comfortable around their peers and provided them with a support system.
According to Marquette Today, mindful treatments, especially Mindful Mondays, can significantly reduce anxiety, depression, and stress levels by about 20 to 30%. Since Mindful Mondays bring together students, it ultimately serves as a time for these students to understand that taking just a few minutes for yourself is a beneficial way to treat your mental health. As students surround each other, they realize everyone has internal struggles, no matter how perfect or put together they may seem.
After all of the Mindful Monday sessions, we had each of the students in both classes answer 3 questions regarding Mindful Monday. The first question was if the individual enjoyed Mindful Monday, in which the overwhelming majority said yes, with only a few people saying no. The second question asked, did you incorporate meditation to your life following Mindful Monday? While the results of this question are around 50-50 for yeses and nos, these are actually great numbers. One study by the Society for Research on Adolescence found that only 5.4% of people ages 4 to 17 practice any type of meditation. By implementing Mindful Monday into our week, we were able to introduce meditation to those who are unfamiliar with it. You can see the rewards of meditation reflected on the third question. Did Mindful Monday benefit you and the outcome of your day? In which we again see a staggering amount of yeses compared to nos. By being introduced to meditation and experiencing it every week, students were able to see the benefits on their day and are able to use this lifelong skill to help them in the future.
These were our helpful sources.
Thank you for donating your time to listen and complete surveys regarding our Mindful Monday presentation and project. We sincerely hope that you better understand the importance of Mindful Mondays and will implement them into your own life starting today. This slide presents the 4 most common mental health hotlines used by teenagers and how to contact them if you need it. Thank you again. You will now shortly open your computer to take the post-presentation survey. If you have any questions, let us know and we'd be happy to answer.